Today, September 29th, is World Heart Day. It's a global event to increase public awareness of cardiovascular diseases, including prevention. This morning, we're joined by Zuleyma Santos. She's a local mother of two who battled heart failure and survived. Welcome, Zuleyma.
Thank you. Thank you for having me.
We love sharing your story here. And I want to begin by asking you, 2 days after giving birth to your daughter, your second child, you were diagnosed with something called peripartum cardiomyopathy at age 36. Can you explain what this is?
It is an enlargement of the heart. It is caused by pregnancy.
Caused by pregnancy,
Yes.
Pregnancy-induced. And also, can you tell us what symptoms you were experiencing when you were first diagnosed with this heart failure?
Definitely a lot of fatigue. I was tired a lot. I couldn't do anything, and I also was experiencing swelling in my feet, and it was going up to my legs from all the fluid retention.
Yeah, all the fatigue. I can't imagine after, especially giving birth. I understand you couldn't even hold your baby.
No.
It was that bad.
Yes, it was. I could not take care of them.
What were you feeling at the time? Were you just so confused and wondering what could possibly be wrong with me?
Yes, I was. I just was thinking my pregnancies were great. I said, you know, what went wrong? You know, what did I do? You know, at first I, thought it was my fault for not speaking up or saying anything, but my pregnancy was actually very good. So nothing during the pregnancy led me to know that that was going to happen afterwards.
And you were fairly young when you were diagnosed. Did doctors tell you anything about, why?
No. No, they just pretty much, when they gave me the diagnosis, they let me know that it was caused through pregnancy.
Zuleyma, I understand that at the time you were not eligible for a heart transplant. So you received a special device to help you.
Yes.
Tell me about that.
Yes. When I ended up at Keck Hospital, they let me know that I was going to need a heart transplant, but we need to do treatments to get rid of some antibodies. And they let me know that there was a device, the HeartMate 3 by Abbott, that would help me go back home and recuperate and be with my kids.
Wow.
So we decided to do that, which is called the Bridge 2 transplant.
And you actually brought the device with you.
Yeah, I actually have it implanted in me, so I actually do have to carry it.
It's always with you?
Yes.
It's in your purse?
Yes.
Can you briefly show us just, what it looks like?
Yeah, it's, it comes with this, my monitor, and 2 batteries.
Yeah.
This is pretty much what I carry 24/7.
Yeah.
I'm carrying it in a purse, but usually I do a backpack just because I'm always running around with the kids, doing drop-off pickups. But it's my life-saving. That's the reason why I'm here right now.
Well, you know what? Thank you so much for coming, sharing your story, and informing us and teaching us, educating us about, what can be done and the technology out there to help patients like yourself.
Oh, yes, yes. I'm blessed to be able to have this right now and to be here and to still enjoy life with my kids and my family.
We are so happy. Thank you, Zuleyma.
Thank you so much for having me.
And to learn more about World Heart Day and the risk factors for cardiovascular disease, just check out our website, kcalnews.com, and click on Seen on TV.